my name is Ivy Corin. I'm a student at the University of West Alabama, and today I'm going to be describing assessment procedures for speech-sound disorders. So according to the American Speech, Language, and Hearing Association, assessment for these types of disorders can take one of two forms. First is just a screening that's typically given to students as they enter school. So this is a shorter process consisting of a speech-sound assessment, an assessment of the child's oral motor function and physical structure, and then just an informal assessment of their ability to produce and comprehend language. So this is used for identification purposes. This helps teachers and speech pathologists see where the needs are and see what children may need further testing. The other form of assessment is a more comprehensive assessment, which would be given to students who, based on their screening results, do demonstrate that need. So the comprehensive assessment would take a bit longer, and it would include the individual's case history, a hearing screening, and then measures of a couple different things. First of all, how severe is the impairment? How intelligible is the child's speech? Is the child stimulable to produce the sound, meaning if they have a model, can they make the sound correctly? And then finally, measures of speech perception. So does the child hear the difference between speech sounds? In other words, can they hear the difference when a sound is produced correctly versus incorrectly? So all that information is compiled together to then come up with a plan for intervention. And ideally, teachers would be able to work together with speech pathologists and the child's parents. Those people kind of form the child's team in order to come up with a plan to provide intervention, possibly providing speech therapy, and effectively meeting the child's needs. But there are some roadblocks that can arise during this process. The main one, in my experience, being that a lot of times, even if the speech pathologist is super knowledgeable and really wants to help and collaborate with teachers and parents, they may not always have the time to do so. They do tend to have pretty large caseloads, and just due to time constraints, a lot of that responsibility may fall on the teacher. And depending on that teacher's level of experience, they may or may not feel qualified to do all of those things. But ideally, those team members would be able to collaborate and work together in order to meet the needs of their students. So when they work together, those children would be effectively identified, intervention could be provided, and information could be shared with parents so that the team could work together to meet the child's needs. Hopefully that was helpful. Thanks for listening. Bye.